Hello, my name is Mercy. I'm a special need educator. Today I would like to talk to you about CP. What is CP? What causes CP? The referrals and what we call the OT. Now, CP refers to the brain damage or the abnormal development of the brain. That means the brain of this particular child has not developed as normal as it is supposed to be. And it doesn't mean that the whole brain has not developed right. As we all know that we have different parts of brain. The part that might have damaged, it's either the part that stands for mobility, or the part that stands for speech, or a part that stands for seeing, or a part that stands for relating and understanding certain things. Or rather, in other ways, you might also find that the whole of that brain has been damaged. I just want to enlighten the parents and the caregivers and all those who have children with special needs around them that that is what usually happens. So what causes this CP to happen? The CP might have happen in different categories. That is during pregnancy, or during birth, and also after birth. Some of the things that happen during time is something like premature labor. We have lack of oxygen and enough supply of blood to the brain. We have meconium fluids. We also have what we call birth asphyxia. This is insufficient flow of oxygen and blood to the various parts of the brain. We also have multiple births, like you find out that you give birth to twins, or even 3 or even 4. When you give birth to multiple births, you find that 1 or 2 of these children might be affected. Why? Because there might have not been enough oxygen to supply all of them in the right time during the process of giving birth. 2, they might not have gotten the enough minerals and required food while they're in the stomach. Another thing that we should also take note, that when you're pregnant, you need to eat a balanced diet. You need to eat healthily, and especially you need to eat these vegetables. You need to take a lot of them because vegetables carry a lot of vitamins. Okay. Also, we have what we call head injury. Head injury, most of it occurs during the process of birth. We also have prolonged labor. Now, these are some of the things that causes CP. Something to do with the prolonged labor. Prolonged labor can be managed. When you have a prolonged labor, please ask them to sign you in for a CS, or if you're asked for a CS, kindly do it as fast as possible to save the child from further damage or from being damaged. Okay. And you also find that mothers who have been through certain cases, when now they are ready, or rather they are expecting another child, you find them they are always advised to go for CS, so that it can prevent possible problems that might affect the child. But it's for a good cause. Usually they are advised to do that. Okay. uh, we're going to talk about the stages, the developmental milestones of a child. The developmental stages of a child is whereby now your child starts developing, and this is when you should see things like smiling. You should see them smiling. That is around the 2nd month. The baby should start smiling and doing some certain things like moving the parts of the body and all that. Okay. If you're a keen mother, in the first 3 months, you might notice either your child is not sitting, is not standing, like does not have the strength to stand. Like I imagine, like the small kids, not kids, but actually the infants, they usually stand. If you try to put them to stand, they will stand, but that doesn't rule a fact that they are a CP. If you find stiffening of body, like the arms are so stiff, you try to pull them and they come back, You pull the arms and they come back. You pull the legs and they come back. Now, that is the number one worry of a child that might be experiencing CP. That stiffness comes with something to do on the brain. Okay? Now, you continue to go on, or from the 3rd month to the 6th month, there are also certain things that the child should be achieving. During this time, you notice that the child, maybe the head is still lagging. When you notice that the head is still lagging, that means that the head of the baby is not stable, and therefore you should go to the hospital and ask. If it goes up to 4-5 months, there is a problem. So be very careful and be keen at observing the infants during these stages, so that we rule any case of problems in future. Okay? And you find that most of these things can be rectified earlier if you take them to the hospital and at the right place. These are some of the things that can be rectified earlier. Something like head lag, there is a massage that they are going to do for the baby. It's called occupational therapy. Okay? Now, from the month of around 5th, 6th month, the baby should be sitting. You notice that during that time, the posture of sitting is either inverted or it's oval shape. These are some of the shapes that affects the child. That means that the child has a posture problem, especially when it comes to sitting. You should therefore go to the right practitioner to advise you on what to do. This is also an alarm for you to start going for occupational therapy. From the month of now, the 7th month, 8th, 9th, and the rest, the child should be standing on their own. They should be trying to reach for things. They should be observant, and they should notice things like colors. That is why during this stage you should at least try and give the child toys of different colors. Giving them a toys of different colors like red, orange, blue, white, it is working on their brain, and they will be able to, you will see some interest, and you will see them reaching out for these colors because the colors are very attractive to them. It is also a way to monitor the child's brain. If the child's brain is working, that notice and interest that a child does when you give them toys. That's why it is important to put toys and give them toys to play with, to help you notice if the brain functionality is okay. That is the recognition of colors and shapes. Okay? So you notice during this time the child cannot recognize. The child can only look at the object but not pick. The child cannot babble anything. You try to talk to them and they don't babble. Anyway, you are also advised to be talking to them. You know, talking to a child from as young as 1 day old is very important. They'll get to know you. They'll listen to your voice, they'll understand you, and they will know if you come near them. It is important to talk to them because they listen and also understand you. Okay? So, you notice that, and to some children, when you give them toys to play with, they might not pick, they might just look, and they might also not even have interest in those toys. This is also an alarm to notice that they are not interested in this thing. It is an alarm of CP because there is no that recognition of something that is interesting or something that is attracting them. There could be a problem there. Okay? And that is why I tell you that you need to go to the hospital and tell, anytime you attend these antenatal clinics, you need to go there and attend and ask them. Supposedly you have any problem, you need to ask them. After asking them, they're going to examine you and they are going to send you to OT. OT is the occupational therapy for kids. When you go there, they're going to do for you what we call assessment. This assessment, you're going to be asked questions from when you got pregnant to what you experienced when you are pregnant to the time you gave birth, and after birth. You're going to be asked questions. You need to remember everything and you need to answer everything correct so that your child might be helped during this time. Anyway, thanks for listening, and I'm looking forward to come back again with more insights. If you have questions, please post on my comment section. I'll get back to you. And thanks for listening to me. Bye bye.